Okay, heavy metal toxicity. This is another very big one, again, because, and I say heavy metal toxicity, but this is really all environmental toxicity. Whether it's heavy metals, whether it's pesticides, parabens, polyphenols, bisphenol A, BPA. There are a host of chemicals that are in our bodies that shouldn't be in our bodies. When we're exposed, our bodies are exposed to these environmental toxins. It creates oxidative stress in the body, which then causes cell damage and cell death in most cases. Also, this oxidation lowers your pH, or makes you more acidic. The more acidic you become, the more prone you are to candida, as an example, or other yeast issues, prediabetes, osteoporosis, and all degenerative bone and joint diseases. Of course, obviously these cause chronic inflammation. And it's the chronic inflammation that you're going to end up going to a given provider about to say, hey, my hands hurt, this kind of weather's coming through and I'm really feeling it today. What you're feeling is that inflammation, but this isn't a cause. This is the end product of the rest of this, right? And in most of the time, it takes years or months or years to build up to get this from here all the way around the horn to here. This isn't an overnight process. But obviously, if we want to fix all this, you can either intervene here and just help one step, or you can intervene here and help that person better handle this and get rid of what's been accumulating in their body for the last months or years or decades in a lot of cases. Symptoms of heavy metal toxicity, and you can see there are many. Lack of energy, memory loss, depression, anxiety, restlessness or restless leg syndrome, mental fog, nausea, insomnia, allergies, nervousness, skin irritation, food intolerance, body aches and pains, frequent headaches, muscle stiffness, frequent colds, cold spot sensation, deteriorated vision. A lot of these you could also put in the previous slide in autoimmune disorders, right? Mm-hmm. So you're going to see a lot of this stuff overlaps. And so, and again, it's not a concern to me to tell somebody they have MS or they have fibromyalgia or this or that. I'm simply saying, look, you have different functions in the body that are going wrong, and here's what we're going to do to fix those. I don't care what box you fit it under. It doesn't matter at the end of the day. Nobody's walking around with a tag on that says, I have fibromyalgia. Well, frankly, some people do now because they're wearing ribbons and all that, but you know what I mean. Some people want to be known by their disease. We don't want people to be known by their disease. Disease is linked to heavy metal toxicity. ADD, autism, and anything on the spectrum, autoimmune disorders, chronic fatigue, Lou Gehrig's disease, Gulf War syndrome, Alzheimer's, Parkinson's, thyroid. So again, very common. In fact, we're talking about most of these today. Now, for Genesee County in particular, we're in Lapeer County over here, but in Genesee County is notorious for having elevated arsenic and lead levels. In fact, there was a little girl I had, this is maybe 2 or 3 years ago now, about 2 years ago now. She came out from the Clio area, and she, a little 9-year-old girl, sweet little thing. And to look at her, she was just totally blank. No expression, made no facial movements whatsoever when she spoke. And she was referred to our office by her teacher, who had said she always caught her literally leaning on her desk because she couldn't sit up straight. So we tested her, and she had a uranium level that was so high, the lab called us and said, get her in there, get her back now to start something. This is uranium. This is like atom bomb stuff that this girl's exposed to in Clio, Mount Morris area. So, and secondly, her arsenic was like in this top 75% up here. So I called mom and daughter back, showed them the result, and the mom says, yeah, well, her school sent out a thing like 2 weeks ago saying that they couldn't drink out of the drinking fountains at school because of the arsenic content, but in 2 weeks it was going to be okay. Just think about that. Well, what's going to make that better in 2 weeks? We have decades of auto industry dumping into the ground and the water supply, and what's going to make that go away? Uranium in somewhere here in Genesee County. It's nuts.
Can you speak to what does the testing is? A blood test or?
You can do it different ways. That's a good question. This version here is a urine test.
Okay.
So what happens is, and we do it as what's called a urine challenge. So you would get a very specific chelating agent. We use something called Chelax, which is DMSA and calcium EDTA in an oral capsule. You take 4 of those capsules, and we then collect your urine for 24 hours after. And it shows us what that chelating agent is pulling out of your body. Okay? And the urine challenge is actually the most sensitive of the versions. There's urine, which is what we do. You can also do it by blood, and you can also do it by hair. The problem with blood is that you're not getting any levels that are being stored in your organs.
Right.
Liver, brain, heart, lungs, etc. With hair is very good tool because it's non-invasive, first of all, but it doesn't eliminate external sources. So for example, if you're around, let's say you work somewhere and there's a factory across the street. You know, it's going to get into your hair. That doesn't necessarily mean it came from within your body and out through the hair. It just means your hair was exposed. Does that make sense?
Yeah, it does.
So it's, in some ways that can magnify the result even if it's not true. So, I mean, not that that's all bad, because it still means, hey, you're getting exposure from somewhere, you know, you need to figure this out. And a lot of times you would see that like in some way who lived in a house where somebody else smoked, as an example, or a child or somebody else smoked.
Is topical exposure the same as like internal exposure?
It depends on the chemical.
Okay.
So like,
Oh yeah, like fuel, diesel fuel, car fuel, you ride around every day, you smell it every day. They have lead in it, so.
it has, yeah, it's the same, has the same effect, absolutely. It's absolutely true. Now what will happen is, the problem when you have heavy metal buildup is when you look at the surface of a cell, think of the surface of a cell as having so many parking spots all around it, okay? So let's say you have a cell here that has 10 parking spots around it. Those parking spots are normally where all of your minerals attach to the cell to then carry out normal function and enter inside the cell and do what they need to do. The problem is these heavy metals compete with your good metals for those same parking spots. So if 8 of these 10 parking spots are being built up by mercury, or being taken up by lead, mercury, nickel, tin, arsenic, etc., now you don't have any spots for potassium, magnesium, chromium, selenium, other things that are supposed to be there. So now, not only do you have the problem of having all of these cause inflammatory issues and autoimmune responses, these cause symptomatic mineral deficiencies. Even though you have the right amount of minerals in your body can't use them. So you still have to get all of this out of there, one way or another. Another thing here, so that's the best picture I could find. I was asking my wife, this is a little too weird for the public library. But anyway, the purpose of this is to show that also everything you put on your body gets into your body. And there are a ton of chemicals, looking even in shampoo, sodium lauryl sulfate, tetrasodium propylene glycol, eyeshadow, polyethylene terephthalate. I mean, look at the side effects: linked to cancer, infertility, hormone disruptions, damage to body organs.
Doesn't say that on the label.
Lipstick.
It just says
Yeah,
it'll
no, it
make
says
you
made,
look
yeah, it says
beautiful.
made in China. I mean, I'll let you read through all these, but I mean, fertility problems, kidney damage, anything. One thing, if you took nothing away from the cosmetic aspect of this too, parabens, whether it's ethyl, methyl, propylparaben, or polypropylparaben, paraben molecules have been totally banned in Europe in cosmetics. What parabens do is they're a delivery molecule they add to cosmetics to purposely break through the skin to allow the ingredients of that particular makeup or shampoo or whatever to get into the skin to moisturize it or whatever the product is. Parabens cause, intentionally by design, tissue destruction. Okay? That's why the side effect is rashes, irritation, hormone disruption. For heavy metal toxicity, and this also works, I always say heavy metals, but it also works for pesticides, parabens, etc., is chelation therapy. Is the main way to get rid of it. Now, there are 3 ways that it can be accomplished primarily. IV is the fastest, but not everybody can tolerate IV. And you have to be very careful with IV because people with certain issues like advanced heart disease or some other things cannot have IV versions of chelation. So you have to be very careful with that. Or people with blood clotting disorders and some other things really shouldn't have IV chelation. But IV chelation is the same, like we mentioned with the Chelex, it's calcium EDTA, or DMPS, DMSA are the things that can be used in IV. Sometimes you can also use something called glutathione, which is an amino acid that also works very well. That can be done IV. But again, typically IV chelation is 2 IVs a week for 6 weeks total. You have 2 IVs in a week, the next week off, the next week 2 IVs, the next week off, and keep going until you're at 6 weeks. So you've had 3 rounds of IVs, or 3 weeks worth of IVs in a 6-week time period. A lot of people like that because, hey, they get it done over fast and they're good. If they don't want to do that, there's an oral version, which is the Chelation or other things. There's DMSA that can be used. Also, you can take L-glutathione orally. It doesn't absorb very good because, again, it's a larger molecule. But there are certain sublingual liquids that you can take of glutathione plus transdermal creams that have L-glutathione that you can use to absorb to the skin instead of orally. Those all work as well. They just take longer. For example, a lot of times in our office, instead of 6 weeks in an IV chelation, if you're to do it with the exact same stuff by oral route, by capsules, it's going to take you 12 to 18 weeks to accomplish the same benefit. So it just depends on that individual. Some people don't want to take the time to come in and have IV, so they'll do it at home, and that's fine. Other people want to get it done faster, feel better faster, whatever, so whatever way is fine with us. Now, there are some people who can't do either one. And the reason being is some people are genetically predisposed to what we call methylation defects. And methylation, the methylation pathway is the pathway by which your liver detoxifies your bloodstream as one of the 2 parameters of that pathway. If you are genetically positive for what they call methyl tetrahydrofolate receptor reductase defect, MTHFR, you're not going to respond to these 2 types of chelation as well. Instead, you use the second most important detoxifying organ of your body, which is not your liver, but it's your skin. So at that point, and what we just call skin chelation, is to utilize means of detoxifying by sweating it out. Whether that's a dry sauna, whether that's clay bath, whether that's hydrogen peroxide, food grade peroxide, and soaking in that. I mean, there are ways to do it where you can pull it out through the skin, open your pores up, sweat it out. Jogging and sweating will also do the same thing, but I would imagine most people want to sit in a dry sauna and not jog 5 miles. So, even though we probably all should jog 5 miles for once in a while.